My name is David Jeffrey and my role is the Senior Planning Officer Telehealth for Southern New South Wales Medicare Local. The Commonwealth Department of Health and Ageing recognised that access for rural and remote communities to specialists was increasingly difficult, both in terms of our ageing communities and increasing disease processes and illnesses. And so they developed the Telehealth initiative in July 2011. The uptake wasn't as good as they had projected. So in June 2012, that was when my role commenced. The interesting anomaly about our Medicare Local is that we don't have a lot of specialists in our region. We do have a number of specialists, particularly Bega, some up here in the Urbadalla, and certainly some around the Goulburn region as well. But principally, Canberra is our tertiary referral centre, so we have a lot of connectivity with Canberra. So my role at times is working with the general practices that actually have started telehealth, looking at what they're doing to see how I can facilitate and augment their practices. I've been to a number of specialists and gone to their rooms. It's about looking at what software they've got on their computer, whether it's a Windows-based computer or an Apple computer, and then installing the appropriate product. Principally, most practices tend to go with Skype. It's plug and play and it's easy, and that's fine. It gets people started, and that's principally what the project is about. My role covers the entire region within Southern New South Wales Medicare Local. My office is based in Maruya on the south coast, but frequently I do travel across the region to Goulburn up in the north and western corner, down to Yass and all the towns in between. The region includes the Snowy Mountains, communities such as Cooma and Jindabyne, down to communities such as Eden, right down the far south coast, and then coming back up to Batemans Bay. I've recently held a very successful telehealth event within Canberra with specialists and Dr. Jenny Wray, an early adopter of telehealth, and she certainly is a pioneer in terms of our region as well. She was one of the guest speakers, and interestingly there was some specific feedback saying that Jenny's talk was invaluable and compelling were the terms that were used. And certainly she's been a great support in terms of that, and also her experience to deliver to the patients within the communities around Bermagui and Narooma.
I'm Jenny Wray, GP, Narooma and Bermagui. I've been in Narooma for 35 years, nearly 36, and Bermagui for just 1 week short of 1 year. We opened a practice at Bermagui just before Christmas last year because Bermagui was actually very light on medical services, and it's been really quite a wonderful thing to have done. I think the community was really crying out for medical services. And although it's not a remote town, a lot of the people who live here are really quite poor, so that for them to actually be able to access any other services is actually very difficult. We have a lot of elderly people and a lot of young, either working poor or non-working poor. Telehealth was initiated from within our practice, and mainly from Bermagui more than Narooma, because it was very difficult for our patients to actually access medical services. They actually have to travel between 30 to 60 minutes for most services, including physiotherapy, specialists, the eye specialist, and the hospital. So when Dr. Mark D'Souza approached us through just a group email or fax, I can't remember now, it was just a comment to say, I just want to let you know that I'm actually available for telehealth consults.
My name is Mark D'Souza. I'm a general paediatrician. I am based in Nowra in the Shoalhaven district. I do clinics as well in Ulladulla, Batemans Bay, Bega and Pambula. So in that role, I provide a service that extends from Nowra down to the Victorian border. And so both for me travelling down there and for patients travelling up to see me, that's an awkward distance, especially if there are things which need to be done relatively quickly. So telehealth makes absolutely total sense for my practice for those distant patients. So in terms of these consultations with the MBS items, I've been doing them since the start of this year. So I've got at least 6, probably close to 12 months experience doing them. I'm finding that the number of consultations I'm doing is increasing steadily. And because I am able to do it from my desktop, from my desk, really it fits in just like a normal consultation. It's absolutely not a substitute for a proper clinical assessment in your rooms, so seeing the patient face to face and laying your hands on the patient and examining them. So it must never ever be seen as a substitute for that. But as an adjunct to those patients whom you are actually seeing or going to see in person, it's terrific.
The MBS incentives were, I think, quite wonderful when we actually accessed them, but that wasn't the reason why we actually went ahead and set up the telehealth. It was more out of providing a better service for our community.
The impact for the family members, it can be huge. Often it can entail the actual patient plus a support person, plus or minus some children in tow as well. And so what principally can be a 15-20-minute doctor consultation, maybe an hour consultation, suddenly becomes a full day venture, and there's significant costs with that as well.
Patients, especially the ones who've had to travel sometimes a couple of hours to see me for 10 minutes for something fairly straightforward, find that they can do so from the convenience of their home and with much less effort and cost, and with exactly the same quality of service for the simple questions.
I'm Frances Todd, and I'm from Bermagui. This is my daughter Sarah. I have 4 children, and some of them have certain health conditions, which means we travel a lot to the doctors. And with Sarah and my younger daughter, they need to see the paediatrician. And so when we were visiting Jenny Wray to discuss their health issues, she suggested the teleconference so that we didn't have to make the trips to the paediatrician. And the other reason too is because they go to school here at Bermagui, but to pull them out of school and go to Bega, that's a full day wasted. So she suggested, let's do this teleconference here at Bermagui where we can link up and talk to the doctor direct, and anything that we don't understand in medical terms, Jenny's with us in the room, and we can also ask Mark questions relating to follow-ups and things like that as well with those tests.
The impact of telehealth consults on the health of our patients has been enormous. It has meant that they get much less fatigued, because to travel long distances to see a specialist for half an hour can actually take a day's travelling both ways to get there, which is, for someone with a chronic illness or who's elderly or has a young family, that's very tiring. But in addition, I think that they've actually quite enjoyed the 3-way consultation, having the GP there as their advocate and talking to the specialist at the same time. I think that has also given us an opportunity to learn what the specialists want, to see how they conduct their consultations, and to be better prepared for the next time that we actually refer someone to them. The access to telehealth consults has impacted on our practice and our ability to deliver services to our patients enormously. It means that it's given us a much greater range of people that we can actually access and provide much better services, especially for Bermagui, because we don't have any visiting specialists here. So it has meant that we've been able to access an orthopaedic surgeon in Bowral, a renal physician in Melbourne. We've as yet got a couple of psychiatrists that we have referred to in Sydney.
So it's improved not only access to patients, shorter waiting times, but it's also improved day-to-day communication for simple questions. It's been really a very effective strategy in boosting the quality of my practice. In terms of the challenges for integrating the service into my practice, my secretary is very pleased that she can offer patients appointments more efficiently than we were able to do previously. So it's actually made things easier from a booking point of view.
Yes, I'm Erin from Bermagui Medical Centre. I'm the practice manager here. Setting up telehealth here was really easy. It's pretty straightforward. Just have to contact the doctor and the patients, work out a time that suits them both, and organise with the doctor, and that's pretty much it. It's very easy. But we have all the equipment here. It only takes a computer and a little camera we've got on top here. So we've got that all set up. We've got Dr. D'Souza in our Skype address. So all we do is About half an hour before the interview starts, we just contact the specialist, whoever it may be, and just make sure everything's working fine.
The technology with telehealth is diverse. It can be on a more simple level, from just quite simply a laptop with their web camera built in, which is quite a common use at the moment, or it can actually include a desktop computer with a web camera sitting on top, iPads, or the smartphones as well. So there's a range of different hardware that people can use, and then there's the costings around that as well. And they're not hugely expensive in terms of outlay, and most people have the equipment within their practice, be it a specialist or within a general practice as well. So it's quite freely available.
When you do start using this technology, it's important to test it, and in particular, you're testing the quality of your internet connection from site to site. It is really important to do it before you actually schedule a consultation, because it is extremely frustrating to spend 10 or 15 minutes of your day trying to set up a technological hitch when you're busy. The technology is simple, it's cheap, and the administrative setup can be done by any capable and competent medical secretary.
Dan, how difficult was it to actually set it all up in the beginning? Because you did all of that for us. We just moved in and did the consults. But what actual infrastructure did we have to provide to do it?
Look, it's not difficult at all. We use Skype as our software program for conducting telehealth conferences. Now, all we had to do was purchase some webcams, which were under $50 really, so it was really quite cheap. We downloaded the program Skype and we were away. Basically very, very simple.
Our practice actually works very well with a team approach. So we actually have engaged our medical students when we actually have them with us. We have 6 practice nurses and GP registrars. And so with the nurses and the medical students, it actually enhances that whole primary care team approach to patient management. And quite often, the patients actually see the nurses within the practice more often than the GPs, so they're actually they're quite comfortable for the nurses to actually be there for the telehealth consult with the specialist. Telehealth is actually becoming part of our normal clinical practice, and I think that we're limited only at the moment by the numbers of specialists we can access. So the more specialists we can access, the more of this we're actually doing.
I think the telehealth consult will become normal business, and so people will be quite comfortable talking to the specialist on the other end of the screen, and they'll think that's quite normal, which is, I think, again, great. And it comes back to the fundamental principle of the telehealth project of increasing access to specialists for rural and remote communities.
My advice to other people who haven't actually embarked on telehealth consults would be that there are a few things. The first is that it's going to be really beneficial for your patients. The second thing is going to be beneficial for you because it gives you all sorts of information in a timely manner and quite expeditiously that you won't get otherwise. There are government incentives through the MBS, which I think certainly make it worthwhile to give it a go. And last but not least, I think it's just wonderful for the patients because they can access services which previously they've not been able to.
Doing teleconferencing, I feel, is a big benefit, and any patients out there who want to give it a go, I say do it. You're going to save yourself money, time travelling, delays with the doctor that you can't see, and it's all here done with your own doctor in the room with you. So anything that you can't or don't quite understand, you've got 2 professionals there to help you with. So why not give it a go?
In my practice, I think that it has been a major enhancement, and if you have not been using it as a doctor or as a patient, I would only encourage you to think about how it might help you, and I think you'll be surprised at how useful it is.